MOVAO Bari is a mobile exercise platform designed to promote muscle recovery for patients with severe weakness and the inability to safely stand. With a 750-pound weight capacity, MOVAO allows for early and safe closed-chain exercise for low-functioning patients of all sizes. With the push of a button, gravity can be controlled, bridging the gap between bed rest and standing with full body weight. MOVAO is indicated for patients who are medically stable and clear to mobilize, able to follow simple commands, display at least a trace of leg extensor muscle strength, and unable to safely stand due to weakness, pain, orthostatic intolerance, or a fear of falling. The MOVAO Bari can be accessed a few different ways: performing a stand pivot transfer onto the seat of the carriage, using a patient lift, or directly from the patient's bed with a lateral transfer. Now, let's look at the components of MOVAO. Hand controllers are stored in the safety rails located on each side. The top row is for tilting, to increase or decrease exercise intensity. The second row is to elevate the head from 0 degrees to 50 degrees. The third row is for raising and lowering with dual column lifts, from a low of 21 inches to a high of 34 inches. And the bottom two rows control the force plate angles, DF to increase dorsiflexion and PF to increase plantar flexion. To release the side rail, grab the top rail from the outside and with the other hand, lift upwards on the orange release handle. Slowly lower the rail until it tucks underneath the carriage for a zero-gap lateral transfer. When elevating the side rail, lift up until it clicks and locks into place. Before transporting MOVAO, it helps to retract the carriage to make a smaller footprint. First, lock the casters by pushing down on the orange side of the foot lever. One single lever will lock all casters at once. Then release the carriage locking handle by turning it to the horizontal position, allowing the carriage to freely glide. Lock the carriage by turning the handle downwards. To transport MOVAO, move the foot levers to the horizontal or neutral position, allowing all four casters to rotate freely. Using the force plates to steer, begin to move the MOVAO. Once moving in a straight line, press down on the blue side of the foot lever. This is the steering position. This will hold the front left caster in one direction, making it easy to maneuver in hallways. Once at bedside, align the ankle support pad with the patient's feet and lock the casters. Unlock the carriage and glide it outwards until the split of the carriage is centered with the patient's greater trochanter. Lock the carriage back in place. Place the casters in the neutral position and push the device against the bed. Lock the casters. Then plug in the MOVAO. Adjust the height of MOVAO to the bed height for a lateral transfer. A transfer tube or a lateral transfer device is preferred to minimize lifting forces. Once the patient has transferred to the midline of the carriage, place the casters in neutral and move the device away from the bed. Relock the casters and raise both side rails. The head can now be raised for patient comfort and the chest strap applied for patients with poor trunk control. MOVAO's patented force plate system features two modes, peak mode and exercise mode. Peak mode is used to objectively assess leg muscle strength and is the default mode upon first use. Each display has a large number that shows the highest force exerted for each leg. Keeping the highest force allows the patient several tries to increase their 1 rep max. Exercise mode is used for active exercises and strength development. In exercise mode, the maximum muscle force from the previous peak force test is mapped to the LED light bars for visual biofeedback. The right force plate features a touchscreen display showing the force applied in large numbers. The 0 button resets the force plates when pressed. The settings button is used to calibrate each force plate, and the pounds/kilogram button switches the units from pounds to kilograms and vice versa. The screen on the left force plate is not a touch screen, but simply a display. Any adjustment of force plate settings should be done from the right display. The maximal isometric strength test, or the MIST, must be performed at the start of each session to set the exercise intensity dosage. To perform the MIST, hold down the third row of buttons on the hand controller for the standardized testing position, which is 45 degrees of hip flexion, 45 degrees of knee flexion, and 10 degrees of ankle plantar flexion. Zero out the force plates if needed. Unlock the carriage and assist the patient to 45 degrees of knee flexion and lock the carriage. Use a goniometer for optimal results. Next, instruct the patient to cross their arms and on command, push as hard as possible through the legs for 5 seconds. 1, and push. Good, push. Good, 1, 2, 3, 4, 5, and relax. Great job. The peak isometric force will be recorded and displayed for the right leg and the left leg. The total peak force is located on the top left display. Perform the strength test 2 or 3 times, and the highest measurement achieved will be recorded as the peak muscle force. At this point, make sure to document the right, left, and total peak muscle force. Upon entering exercise mode, these numbers will disappear, as no patient information is stored on the force plates. Yep, you beat yesterday's numbers. Great job. If the patient is unable to perform the test due to a cognitive impairment, simply lean into one force plate to establish a working weight, then advance to exercise mode. To begin the training session, press the peak icon on the touchscreen on the right force plate to switch from peak mode to exercise mode. The peak force, or the 1 rep max, is now mapped to 100% of the LED display. The green zone is 0 to 50% of the 1 rep max. The yellow zone is 50 to 90%. This is the optimal zone to build muscle strength. And the red zone is 90 to 100% of a 1 rep max. For example, let's say a patient's peak force is 30 pounds on the right leg. Well, when we advance to exercise mode, 50% of peak force will be at 15 pounds. This is data-driven exercise prescription. Educate the patient on a slow and controlled squat down to approximately 45 degrees. Visual biofeedback of the LED display can be used to promote symmetrical weight bearing during the squats. Let's try to get some weight over to the left. You want to try to equal those lights out. There you go. We're at 60% of your 1 rep max. Come on down nice and slow and push. Weight shifting exercises can also be performed with static standing using the LED display. Put all that weight over onto one side, weight shifting. Lap it on the right. Great job. The range of motion limit bar is a safety mechanism to prevent knee buckling. Lift the handle and the bar can be raised up for shallow squats or lowered for deeper squats. Once the patient is familiar with a controlled squat with low resistance, increase the tilt using the hand control. Push. There you go. Push hard. Excellent. Come on down. Consider starting off with sets of 40 to 50% of peak force range and progress as tolerated. During rest breaks between sets, lower the tilt angle and then lock the carriage. Always prepare the patient for resistance before unlocking the carriage when at an incline. For unilateral exercise, lower the appropriate force plate with the hand controller. Remove the support pad from its holder on the back of MOVAO and insert the leg support pad into the carriage. Unilateral leg exercise is appropriate for patients with amputations, unilateral weight-bearing restrictions, and it can also be used as a forced-use application of an affected extremity in neurological rehabilitation. Good, keep going, push, 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 push. Excellent. After exercising, place the support pad back into its storage location. If a patient has severe leg weakness and only tolerates training at a very small incline, elastic cords are stored underneath the carriage that can hook into the ankle support pad. When engaged, the elastic cords pull the patient back into knee flexion, keeping the quads engaged throughout the exercise. They also provide an increase in resistance at the top end of the leg presses. Excellent job. Other activities on MOVAO include upper extremity exercises, trunk control exercises in a weight-bearing position, and upper body strength testing using the fixed force plates. And we'll pull 2, 3, 4, 5, relax. To accommodate an ankle plantar flexion contracture, simply increase the force plate angle with the hand controller. For a weight-bearing heel cord stretch, the force plates allow for 10 degrees of ankle dorsiflexion for a sustained heel cord stretch. To transfer the patient back to bed, bring MOVAO into the flat position, lock the carriage, and slide the patient over. Refer to the user manual for full instructions.